one, you don't know what the numbers are in China. China tells you numbers and
fam, just say it. You don't believe it. And you're not the only one. Like, no one wants any more Chinese people to get sick. But if they're lying about their numbers, that proves my point. Like, when the vaccine is here, who is gonna be priority? Because at the moment, every nation is by themselves. Like, they're not working together. They should have worked together, like in the 2009, pandemic, the swine flu. People work together, like the CDC, the Mexican and the Canada, all countries came together, but now look.
Cruise ships used to be considered fun. But in the course of the last month, an invisible and deadly passenger on board, coronavirus,
Apparently,
has turned many
Australia
of them
let
into
people from
vessels
the Ruby
wanted by
Princess
no one.
dock
They
on
need
their
to leave and
ports.
go to their own countries.
It's not fair on us.
14 of these people
governments
turned
won't
out to
let
be
them dock
infected with the
because they
coronavirus.
fear a deluge of sick
I think
people.
it's because of their
It's a big
negligence
problem
that they
for
were never
Australia, 'cause
tested.
we
These
don't
people were
wanna be
never
seen as a
tested
place
off the
that
ship.
cruise ships around the world can come to. We've got to
And
make
just
sure we
because of
solve
that,
the problem. Get
The
the cruise
Australia's
ships away.
denied docking
Our health
for all other
experts
cruise ships,
warn of catastrophe if we let them in.
condemning hundreds of
So we say,
passengers
all right,
on
we'll
those
take
other
you all
12
on
ships.
and we'll totally collapse and we'll become an Italy or a Spain.
Understand where they're coming
the
from,
Australian people
but just like the Ruby Princess, only 14 out of hundreds were infected.
Specialist, Dr. Clay Gollidge is not surprised that coronavirus has thrived on cruise ships. He deems these tourist megaships as the perfect breeding ground for all
That
viruses.
means with every minute spent
So
on
you've
that
got
ship,
the
it's a
steel
risk
and
for
aluminium
infection.
structure
And even if they
full
made
of
the trip
hundreds,
back to their homeland,
thousands of
that would be
people in
time
relatively
too
confined
long.
conditions.
Every
A
minute,
lot of those
every
passengers
hour.
are elderly. A lot of them have heart disease, lung disease, diabetes, peripheral vascular disease, smoking, etc. You've then got the crew. The crew quarters can be pretty awful. 4 or 5 people in a room, no windows, shared bathrooms.
My point
So everything's
isn't
kinda
the
ripe
actions of
for
Australia,
cross-infection.
What
China,
you're
or any
describing
other
to me
country.
is the
My
sort of
point
perfect
is
floating
the way we've
laboratory
dealt
to breed these.
with this
Correct.
pandemic.
Incubator. So
It's not the first time we've seen a
viral
pandemic.
incubator
2009,
for
the swine
coronavirus,
flu.
and you couldn't
1970,
restrict
sorry,
it. The longer you keep
1957,
people on
we
this,
had
the
the
more cases
Asian
you get.
flu. And I could say the Spanish flu, but those people never united. Like, who cares about the numbers? Every number out there is another
no,
misery,
I think it's a tribute
another
to our
person
testing.
suffering. So it doesn't
number one, you
matter.
don't know what the numbers are in China.
We
China
should be praying
tells
for
you
less numbers
and,
because the health service is
Without
struggling.
doubt, the doctors,
supplies are
nurses
running
and
low.
other healthcare workers on the front line of the coronavirus war are heroes.
Thank you,
But they're
thank
not
you,
invincible.
thank you for your service
and many
and
have real
sacrifice.
concerns about their own
Thank you.
health. They don't want
We
to catch
truly appreciate.
COVID-19. Tragically, around the world, the rates of infection and death among medicos are staggering, and mostly it's because they don't have adequate protective equipment. In Australia, hospital staff are reporting shortages of basic safety gear like masks, goggles and robes. And some are also claiming that with the pandemic on our doorstep, we foolishly allowed huge quantities of this equipment to be sent to China.
So China should
As Liz
return
Hayes
the favor
reports,
because they
protect
have
us.
stopped the
Get
spread.
these things onto the front line as soon as possible. This may not be the
In the
message that's
1918
coming
Spanish flu, no
from,
one
you
wanted
know,
to
the
take
managers
responsibility,
and
right?
the governing bodies
No
of
one wanted to
healthcare,
take
but this is certainly
responsibility,
the
which is
message
understandable.
from frontline
They were
staff.
at war, and that would make one side vulnerable.
China
But that
manufactures
cost
the
them
majority of personal protection
500
equipment for
million
health
people
workers around the world.
got infected.
But when it realised
And
this
over
unrelenting
100
virus was
million
not
people
going to be beaten,
died
it took an
because they lacked
extraordinary
unity.
step. When this pandemic hit China, what happened to those factories you had there?
So we have 3 factories in China and a factory in Shanghai where the production was requisitioned by the government of China.
When you say requisition, that means taken control of?
Yeah, so the government sent people to take control of the inventory and the production in our factory.
The Chinese government commandeered Guillaume Laverdeux's company Medicon that produces millions of face masks and gowns and stopped him selling any overseas.
It's good to see appreciation. Meanwhile, France turned Africa into its guinea pigs.
Medicine
lab rats.
So one woman, because
Cote
they are
d'Ivoire,
speaking Mandinka,
Gabon,
Senegal, we speak Mandinka
Mali,
and Wolof and Joola.
Senegal, and
So this
Burkina
one woman
Faso
was saying
falling
that
victims.
if the medicine is for sale,
What
she will
scares
buy
me
it.
the
So
most
another
that they are
woman
going
said
in
that,
rural
no,
areas,
it's not for sale.
places that
So
people
this
have
is
never
very sad.
traveled,
They
never
don't
left their
bring it in the
hometown,
capital,
don't
in
even have a
Dakar.
passport.
Because
Like,
Dakar,
how are they
all
gonna
people,
cure them
they
if they
have
don't have the,
smartphone,
you
they
know,
know
the
what is going
coronavirus?
on.
Because
So
coronavirus
please share
started
this
in
video
Asia,
so that people
you know,
can get
and
and see what is
it's only transmitted by human-to-human contact. These people do not have the coronavirus, so they have to infect them to cure them, unless they brought their own lab rats.